First, scanning the spine, I'm going to observe for visual edema, scars, moles, anything that could obstruct my nerve scope. Then, making sure my nerve scope is on and set to medium, I will adjust the prongs so that they will keep a tight seal, narrower in the cervicals, wider in the thoracics. And then I will start perpendicular to the skin. Go ahead and move forward a little bit. And starting at about T1, C7, I will move up in the cervicals. Looking for any over and back quick motion and for a break in the nerve scope. Then adjusting the prongs to as wide as they can go while keeping a good seal in the thoracic spine. I will move S to I, keeping perpendicular angle over the spine, looking for a break. And there's one there. And when I find one, I will go over it 3 times. Then mark the trailing edge of the hot side. And I will carry that on down the entire length of the spine. Okay. Going back to my break, I will go ahead and palp for palpable edema, keeping my fingers on either side of the spinous. Then I will palp the inferior tips of the spinuses, feeling pain on pressure. In the cervical spine, I will palp using one finger, looking for that boggy feel. Okay. Since I'm here, I'll go ahead and palpate the SI joints. Starting at the PSIS, I will palp the superior side. If it is tender, that will indicate a PI. I'll palpate the inferior side of the SI joint. And if that is tender, that would be an AS. If the entire joint is tender, that indicates an EX. And if there is no pain, that indicates an IN, especially with deep inguinal pain. Alright, we're going to motion palpate the atlas. Starting at the mastoids, I'll fall off onto the atlas, and then I'm going to feel the atlas and C2. I'm going to go ahead and laterally flex the head to one side, feeling for the atlas to close down on C2. I'll do the other side. It does not close down on the right, so that is my problem side. And I will rotate the atlas on C2, feeling forward to move independently on pawn C2, and it does not move independently on the right side. Go ahead and stand up. Now I want you to close your eyes and look up and down 2 to 3 times, and then when you feel ready, go ahead and stop your head in neutral position. His nose is pointing up, that's going to indicate a superior atlas. Since the atlas was kicking back at me on the right side, that will be a posterior, so my listing would be an ASRP. Okay, we're going to go ahead and assess the pelvis, starting with the twist. Going to the contralateral SI joint, I'll start with my index finger on the PSIS and my SIF on the sacrum. I will extend the patient and rotate back, feeling for movement. This side does not move very well. I'll check the other side to compare. That one is moving fine, so the right side is my problem side. Go ahead and stand up for me. We're going to do the high knee. And assessing the side of my patient. I'll have my thumb on the PSIS and my other thumb on the sacrum. Go ahead and raise your right leg. Looking for movement here. If it does not move, that would be an indicator for an AS. Go ahead and move the opposite leg. Looking for movement here, and if that does not move, it will indicate a PI. And I will do glute width. Is it okay for me? Okay. The right side is more narrow. That indicates an EX. And the other side would be a little more width, so that would be an IN.